Good evening. Welcome to Live United. Thanks for joining us. As you know from previous shows, Live United is about the opportunities that are going on in the Monadnock region to live united and make a difference in people's lives. Today I'm fortunate to have with me Penny Vane. Penny joins us from Home Healthcare, Hospice, and Community Services and the Maternal and Child Health Program there. And we've had Susan on the show a couple of times now talking about some of the different services at HCS. I'll use HCS for the short end of things. But we haven't had you on, Penny, to talk about the Maternal and Child Health Program. So I'm excited to have you here because, wow, foundation of our future, these young people, and you are doing some incredible work out there. So tell me a little bit about how this even began.
Well, thank you for having me. I'm so excited to talk a lot about maternal and child health. It's a favorite of mine. So maternal child health started quite a long time ago and has really morphed and changed to meet the needs of our community. So at Home Healthcare and Hospice and Community Services a while ago, we started out as a clinic, and we were inviting families to come in and update their immunizations and get a quick healthcare check. And that was sort of before all of the good services were available up at the clinic and things like that. So that was pretty much predominantly what happened at our clinics. It wasn't long before we realized that some of the families that were coming to visit for the clinics really needed other services, and they needed supports. And so we offered social services supports and helped people get connected to the programs in the area that might best suit their needs. And again, it morphed again. So much is developed because we are tuned into what our community needs as well as what our funding sources are to provide those services. So United Way has been a big help in helping us get out there to meet the needs of mostly low-income Medicaid eligible pregnant young women and their children. So we are able to see them from birth right up until age 19 and really do what we can to make sure that all of their needs are met. And when I talk about needs, it could be anything from housing to transportation to getting connected to a good medical home. So if you're pregnant and you don't know quite yet where to connect to get your prenatal care, we can help you do that. We can make sure that you're getting your medical insurance in line. We have social workers and home visitors and nurses who can come out to your home and talk with you about what your goals are, what your plans are for raising your child, and how we can partner with you to make those goals happen. So it's an exciting piece of work.
It really is. And, I think about, I started the top of the show by saying, foundational to the future, and the future success of individuals. When we really think about this, what a mom does prior to birth, and how she takes care of herself, and the resources and support she has to be able to do that, to feel comfortable, to feel educated. Parenting is one of the most frightening
and
experiences
yes.
that I think anyone goes through in their life. And, I can remember, my first pregnancy with my daughter, and wow, I'm reading every book I can find. And sometimes people don't have access to those resources they need. So being able to reach out through those home visits, being able to provide that education, that support, connecting people to services, just so critical prior even to the birth itself happening. And then when you think about the birth itself, meeting the nutritional needs of your baby, your own nutritional needs as a mom. So talk about some of those things that the service itself that you're delivering.
Well, I mean, we all know that the baby, as she's growing in your body, is needing the best of care. So everything that you give to your body, everything you eat or smoke or drink, is impacting your baby somehow. And so our home visitors and social workers and nurses can really sort of help you understand the information that's coming at you. In this day and age, we are getting information from the televisions and from Facebook and Twitter and your friends and your grandparents or maybe neighbors down the street who are all going to give you their input on how to raise your baby and what you should be eating. And we can sort of help you figure out what information you really resonates with you and what information you need to have so that you are giving the best that you can to your baby prenatally. And then as you get bigger and rounder and more full of baby, we'll be talking a lot about how you can bond and how you can be already impacting the brain chemistry in your baby, because we know that when your baby's born, you are going to be the first teacher, and you have everything. We want to be sure you have everything you need to take care of that baby and nurture and grow it. So after the baby's born, a nurse can come out and do a postpartum assessment just to check in on how you and your baby are doing together, do some newborn care techniques, talk about diaper changing and your umbilical cords, baby's umbilical cord falling off, and if you've chosen to breastfeed or formula feed, all of the tips that you might need to hear. When we're in the hospital having a baby, there's so much information thrown at us, and it's really comforting in the next few days after you get home to have somebody else sort of reiterate what some of those pieces of information are and really model how that can happen. As your baby grows and is eating differently or sleeping differently, you only need to call your home visitor, your social worker or nurse and say, hey, I don't quite understand what he's doing now. Is this what teething looks like? How do I tell my neighbor that I don't want her to come into my house and smoke anymore because I know now that it's not good for my baby? Can you help me troubleshoot and problem solve around some of these things? It's really a wonderful, it's an honor for us to be able to really get to know people and see how people make decisions and grow their babies and offer them the best information that they can to do what they want to do well.
And it's so nice that they have that resource there to support them being able to make those choices. And I think sometimes we forget how challenging parenting is, especially early on, especially with the first child, where you really feel like, I don't know how to do this. And it doesn't really matter how many books are out there. You know, every child's different, and you really have to sort of figure it out.
Yeah.
And it's nice to hear from diaper changing to, feeding and just all of those things that we don't really always think about until we're in the situation.
Right.
So it's nice that that support's there. I know that this issue has become one on the national forefront, and certainly in the state of New Hampshire, that there's a lot of advocacy going on around this right now and how we can better meet the needs of our young children, prenatal, right up through, so that they're successful in their lives. What are some of the challenges your organization has faced around maternal and child health?
Well, again, as the economics change in our state and our community, the needs of some of our young moms and their families have changed quite a bit. We have seen a lot more moms who are dealing with substance use and abuse. Housing is a critical issue for many families who just don't have any place to go home to. People are losing their homes to being remortgaged, losing their mortgages, and for the first time are really out on the streets. So our agency and our program really works well, collaborating with many of the other community services. So we're working closely with Southwest Community Services around housing. WIC has been an incredible resource for us in terms of nutrition information for women and infants. We work with Maternal Family Services very closely in terms of providing some parenting supports and supports for those who have some mental health issues that need support. We work with Maternal Developmental Services. When we notice that there may be a child who's behind a little bit on developmental milestones, we can help parents determine that and find them the resources that they need. So as the community's economics change and the needs of our families change, we are there to support them in what they really need. So when we meet with them for the first few times, we're really talking about what is your vision for your family, where do you want to go, and how are we going to get there? So we design a plan of care, and we work on that together so that families really own the work that they want to do, and we're there to get them connected to all of the other community agencies that are available for them. Churches have a lot of resources to support. Any of the Monadnock United Way agencies are people that we collaborate with on a daily basis.
I love to hear the collaboration, and said it on last week's show that really, the Monadnock region does a good job of trying to work together and really pull resources together around different issues. And oftentimes we rely on ourselves here in the Monadnock region because we recognize we can't always rely on the state systems or the federal systems that might be available. I am wondering whether you've been facing it all. You mentioned the substance abuse, and we know more and more babies are being born addicted to opiates,
Yes.
or because of prescription medications or things like that. Is that something that your organization is seeing more and more?
Absolutely, and we're trained up and learning more and more every day. We have a very close affiliation with Dartmouth in Lebanon, who has a really special program for pregnant moms and for their babies who have been born addicted to substances. And so we can provide support to pregnant moms who are in treatment, or even who may not be in treatment, who are aware that their babies might be in jeopardy as they're born. And we can talk with them about what to expect when their babies are born and what the best treatments are for them and for their babies, how best to bond, how to provide that care. And we can model that again at home when they come home. It can be a very scary situation when you're caught up in addiction that you realize is impacting not only yourself but a little baby growing inside of you.
And as we mentioned, that we're seeing that more and more nationally here in the state, here locally.
Absolutely.
And so it becomes critical to have services that can really work with these parents preventatively before the child is born, so that child does get the service that they're going to need upon birth. And so that the mom is also hopefully beginning to make some life changes.
Yes.
As well. So great to hear that kind of support. Any other things you see happening in terms of births and just some trends that are occurring out there that may be positive or may be alarming, and people need to think about why we have to really be thinking proactively about how we address maternal and child health?
Well, I think there's always those risks that every pregnant woman is faced with in terms of what is out there. There's always tobacco use and how that impairs the baby's growth in the womb. There's always substance use. There's even just the trauma of the mom's own previous experiences can impact the baby. So much stress that a mom might have while she's bearing her child really impacts the baby's growth and development. And so the work that we can do is really about finding ways to help mom come to terms with some of those things so that she is providing the best nurturing environment for her child. And we are really adept at connecting moms and making sure that they are feeling like they're getting the support that they need to have healthy, full-term babies. We all know from the money end of things that when you have a healthy, full-term infant, you are much less likely to be paying out of pocket later on for some of those disabilities that can occur when you have an addicted baby or a born premature baby. Those kinds of things add up in the end.
Or a child who early on in their life isn't getting the proper nutritional, educational support pieces and not really preparing them for those next steps in their lives. whether that's kindergarten or ultimately, the workforce out there in the future. So it is, it's so interesting to think about, that early childhood piece and that foundational piece of really how we take care of our children and the people who are the support system for those children.
Another interesting trend, talking about foundations and nutrition, is that there are so many families out there that really don't have enough food. And it's not a matter of opening up the cupboard and saying, I don't like what's in there. It's a matter of opening up the cupboard and not finding anything. And we've had several instances. We've had pregnant women who really are not eating enough to sustain both themselves and their little babies. Again, working closely with WIC to enroll them in that Women and Infant Nutrition program has been really helpful, so that they're getting some of that. But again, that's a supplemental program. And they're often, a week of the month when there really is nothing left in the cupboard. And so we're really, really grateful to the local community pantries, King Community Kitchen, for helping some of those families augment what they have or don't have. But a lot of nutrition education is happening around what moms really need in order to feed their babies best. And then when the baby's born, how they best can support themselves nutritionally so that they can give the best to their children.
And you're right, that has become more challenging. Phoebe's been on the show talking about the community kitchen pantry program and some of who they serve. And it's not the normal clientele that people expect oftentimes. I would imagine even with your program, people look at it and say, well, it's probably this group of women, teen pregnant mothers and things, but it's not. It could be anyone. It could be the next door neighbor. It could be your sister, and you may not even know that.
Absolutely. We always say that you're about three decisions away from being on the streets yourself. So be mindful of that in terms of who is needing services. There are many folks who come through our doors who are sort of new to the system in terms they've never had to reach out for help, and it's a difficult process. We have others who have been born in poverty and don't know any other way and are really reaching out to learn a better way for their children and for their families.
Now, does the program serve around income guidelines, or could anybody access
Well, the maternal
service?
child health program at Home Healthcare Hospice and Community Services is really geared for low-income, Medicaid-eligible women. But because we've been meeting the needs of the community for so long, recognizing that there are some folks that just miss that gap. They don't qualify yet for Medicaid, but they don't have enough income to really make ends meet. And we're also seeing them, thanks to support from the Monadnock United Way, we can do that.
Well, that's good to hear. And I think folks say support from the Monadnock United Way, and it's support from all of you. Because it's the donors out there who make a difference to these types of services, whether they're donating directly or donating in other ways, directly to HCS, through your fundraisers and things. And I'm wondering how else you do garner support for the work that you're doing.
Maternal Child Health has a few grants through the state, and we have a home visiting program that's funded through the federal government. But a lot of the work we do is funded by donors. We just had our second annual 5K Healthy Start race, which was wonderful to watch so many people contribute and be a part of and race and run. And that's become our annual event to support specifically maternal and child health. Home Healthcare Hospice and Community Services has a lot of other fundraisers also to help support the programs within home health care.
Some really neat ones too. I think you do flowers at.
Well, we do the poinsettias for the hospice program.
Right.
Absolutely. Mm-hmm.
Yeah, there's and I'm sure the public can look at lots of times and see that. If someone wanted to access the services, Penny, how would they reach out to you to do that?
It's as easy as a phone call, and that's simply by calling Home Healthcare Hospice and Community Services at 352-2253, and you'll talk to our intake department and tell them what you need, and they will send you our way.
So we're fortunate today to have some photos that you've shared with us to be able to share with the audience. And as we're rolling through those, I'd love if you talk a little bit about what we're seeing, but it really gives people sort of a lens into some of the types of services people are receiving. They go way beyond just people oftentimes thinking of prenatal care or a feeding program. There's a lot more enrichment that's going on there. So we're going to roll those pictures, and Penny will talk with us while we're doing that. And Dave, if you can bring those up.
So aside from home visits, we also try to pull together all our families for community events because it's a great way to build community. Here we are at a spring fling that we held at Home Healthcare this spring. And the Keene Public Library came and read books. We did a gardening project with all the children. The Keene Family YMCA came and did an exercise program. We really sat around and got to know each other and visit with each other, role play how it is to play and how to have fun. It was a really fun sort of bonding experience with all of the families that are part of our program who are invited to come and join us.
Now we're seeing quite an age range here.
So yes, absolutely. We have some pregnant women here. We have children, from infancy up to, I think at this spring fling, the oldest might have been 13 years old, who have been part of our program for a while. Learning to read and understanding the importance of reading to your children is really a crux of it. Eating nutritionally sound snacks and introducing some new ideas about what might be a healthy snack for your 1-year-old or 2-year-old or 13-year-old. Learning about family meals and how the importance of eating together and how that creates a bond within your family and strengthens those ties.
I love that picture right
picture,
there.
yes.
Just the happiness, the fulfillment, you can tell really being with other people and the joy that goes with that.
Mm-hmm. So this is our YMCA Michelle Beam directing us all in how to do the chicken dance, which got us all up moving around. Again, showing families the importance of exercise and getting fit together. We've talked about doing a stroller cruise because there's so many families in the Keene area that want to get out and move around and need a pathway to do that. So we'll be setting up a stroller cruise.
Now, do you work with Healthy Monadnock 2020 on
Absolutely.
some of these
Our
initiatives?
maternal child health program is an organizational champion, as is home health care, hospice, and community services. This is more of the chicken dance and the slide.
Looking like they're having so much fun.
Yeah, it was a great time.
And again, that kind of recreational, that emotional connection. And I would imagine just moms being able to be with other moms and just talk. And do you get dads at these events as well?
Absolutely. We have more and more dads as part of our program. Single dads who are partnering with moms of other children, stepdads. Dads are so critically important to the lives of children, and we want to include them in every way we can. So yes, lots of dads are showing up and providing care for their little ones.
So it's just nice to see that people are able to have that social connection, because I remember as a parent early on, I just wanted to be able to pick up the phone or see somebody else and just ask that question. And you're providing both the staff, the professional staff, to be able to do that. But sometimes you just want to be able to talk to that other parent.
Right. And in the safety of a neutral environment where you can really get to know people and not worry about where you are or where the information is going to be shared to. It's a wonderful, comforting, intimate environment.
And you think about that healthy development and being exposed to both other children, and you mentioned the modeling, the play, parents modeling for each other, and even siblings.
Yes.
Really experiencing, how do I interact with my very own sibling, and seeing other kids doing that, I would imagine is important. So these
here-
are some great photos. I know we're coming to the end
Yes,
of the
so
photos
we had
here.
a wonderful holiday party where all our families were invited first to come decorate our Christmas tree. You can see the decorations in the background. And to plan the party, and then they all came back for a visit with Santa and took some special treats home to decorate their own trees at home. And again, a wonderful time. We had lots of different activities set up for children to make crafts to take home or to give to each other or to their parents. Families were making things for each other. Again, there was a really good, healthy snack that we could all share together. And our families are asking for more and more of these kinds of activities because it's really about community building, and they want to reach out to each other and meet other families that are raising children.
And I think we have less and less opportunity to do that. I think that's our wrap-up photo there. But we have less and less opportunity because people rely so much on technology now. You know, they're communicating through tweets and Facebook and, you know, still via the phone at times, but even that's fairly limited. And so having these opportunities to really connect is just so important. And I think, you know, I don't want to diminish the other part of this, which is really about the health portion of this and just how important that is. But we've got to remember that the social and the recreational part is part of the health of people as well. And sometimes I think we look at it and we say, you know, well, they're having a party and, you know, why am I investing in a party? And we forget that that's about the well-being of the individual.
That's about helping people connect.
Absolutely.
And building their own healthy relationships. That will support them in the long run.
And I can't think of a time in your life when it's more needed than those early years for both the child and for the parents that are involved with those children. Now, I'm wondering whether you're involved in advocacy at all. You know, whether you're involved in advocacy for these families, I would guess you are. But at a state level, at a federal level, is HCS taking any role in that? Is your program?
Absolutely. At the community level, we're always advocating for the people that we work with, whether it's in the schools or for the services that they need. At the community level, we're also advocating for helping people become aware of the need for maternal and child services and how important prenatal care and education is, and for moms to be prepared for their children to be born. At the state level, we are part of the Maternal Child Health Agency at the state level, which does a lot of work around education and working at the political level in terms of ensuring that our programs continue to be funded. At the federal level, home visiting programs, specifically in this area of Healthy Families America, have done an incredible amount of work to advocate for the prevention of child abuse and neglect. And we are doing a lot of advocating at that level too, to ensure that every child is protected and every family has an opportunity to prevent their child abuse and neglect.
And I think that that's a really important message in there, because really the impact you have on individuals is a much broader impact on the community and the region. Because as you change a mom's life or a baby's life, you're changing potentially the risk that they may be under for that abuse, that neglect, a future of poverty, and really breaking that cycle. So we have to keep in mind what the broader impact of these types of programs are.
Yeah. I'd like to share a short little story of, and again, there are many extremes in the work that we do, but we met a young teen mom, or a teenager who was pregnant, who was able, because we were working with her, to advocate that she finished her high school and was able to get her diploma. She graduated, had her baby a few weeks later, who was healthy, full term. Mom felt prepared and ready to bring home this baby to a nurturing environment. Dad was very much involved, supported mom in learning how to breastfeed and support her through all those difficult nights when first-time breastfeeders might have difficulty. Mom realized, because we had talked about it many times prenatally, that she really wanted to go back to work. She wanted to get her her LNA, licensed nursing assistant degree. The father wanted to continue to work. And with all of the work that we were able to do, find ways to support them to do that. So they were finally able to move into their own apartment. Dad had a full-time job. Mom did both. She took care of her child for the first 6 months at home, recognizing that that was a really critical part of her work. Took some classes online while she was home, and is now they're a beautiful young couple with their happy little baby who's doing very, very well, and no longer in need of assistance, really managing quite well. And both parents talk avidly and eagerly about the support that they receive from their home visitor, who came every week for an hour, who talked with them from the beginning about what their baby might be doing in the fetus to what nutritional needs that baby was going to need. When mom was feeling all the pangs of morning sickness, home visitor really sat with them and helped them figure out a schedule that helped mom keep food down. Really helped them develop the relationship with their OB as well as with the pediatrician, so that they were really comfortable to do all of those things on their own.
Just all those little steps that you need in there, and that toolkit really, as a parent, to just feel like I know where to go, I know what I can ask, and or I don't need to be afraid to ask.
Exactly.
And
knowing where to get help, I think.
Right.
And I understand that sometimes we're just so engrossed or so much in the pang of the moment that it's too difficult to call. Even that decision to call or being able to make through with that call can be difficult. And I hope people understand that we're there, we're ready whenever you have a moment to call. We're there.
And where would they call, Penny, if they wanted to
Again,
reach out?
call intake at 352-2253. There are trained people there ready for your call to say, I just need help, I don't know what's going on. And they will steer you in the right direction. Get to us.
And I would imagine that if you can't serve them, they're going to help connect you to maybe someone else who can.
Absolutely. We will do our best to assess what your needs are and figure out what you need, and then get you those services. So we're good at that.
And I want to remind the audience that you can also call 211. 211 will direct you to HCS, to the Maternal and Child Health Program. If you can't remember the phone number that's flashed on the screen, or Penny's the HCS, or don't have access to the website to be able to find out that phone number. So always an option to call 211 and be connected
Absolutely.
to services like this. Penny, are there any needs that your program has? Can people volunteer? Is there a need for goods or anything?
Absolutely. Our program is always in need of diapers and baby wipes. We try to get formula for those families that need it. We try to provide the tangible things that families might need to keep their homes safe. So sometimes electric outlet covers are the one thing that's keeping a child from being safe at home, and that's what we can offer. So any of those things are always helpful. We do sort of a clothing swap for families that have outgrown their baby clothes. We pass them on to the next family that can use them, so we have an opportunity to really share as many resources as we can.
So I'm going to put a challenge out there to some of the schools and perhaps some of the businesses in the community that like to give and find something to really donate to. What a great opportunity to gather people together, really think about how you could donate, do a diaper drive, and see if you can gather more diapers than anyone else in the region. What a fun activity for people to do, but look at what it would contribute to and what a difference it would make in people's lives.
It makes such a difference. It's such a difference when a mom is coming home from the hospital and realizes that she doesn't have what she needs, and it's there because you've offered it to us. I wanted to say a big shout out to the Grace United Methodist ladies, because they have every year offered us beautiful bags that we can give to pregnant moms after they've come home from the hospital, so right after they've given birth, that have beautiful hand-knit sweaters and diapers and little toys and special things for mom. And that's been a real gift for us to be able to give to so many young moms.
Yeah, there's some great programs that do things like that, and so kudos to that group of women. That's a really special, and something that those kids can also cherish further
There's
down in their
heirlooms in there.
lives.
Yeah, this may be
Absolutely.
the one thing that they will hang on to for forever.
Yeah, especially my mom was
beautiful
part of
quilts.
a club that used to do little quilts, baby quilts, for all the babies as they were born. And I always thought, wow, someday when you're 20 years old, you'll look back and that'll be your little
Yeah.
quilt that you got when you were born. So
Right.
those memories are important as well, to know that people loved and cared about you even before you were brought into the
Right.
world.
Right. And for families who have been through so much trauma that they can't even begin to think about what traditions they want to bring to their children, it's a perfect opportunity to say, this is your time to develop your own traditions, dream them up, make them what you want them to be, and here's a gift of blanket to get you started. It's important.
It was part of what I liked in the pictures, because even that tradition piece, you could see it sort of being established there, whether it's a spring fling or reading time, using the library, any
Yes.
of those things. Those are things that you can do together as a family. You mentioned eating meals together, and I know I've done that all my life with our family. We've always made it a priority to have dinner together.
And
it makes,
what a wonderful time.
what a wonderful
But it can
time.
be such a challenge for some to figure out how to manage that family meal,
I just read something, and I think it was the number 976 or 986, but we only get that number of Saturdays with our children in there before they leave us at 18. And when you think about that and put that in perspective, that we get less than 1,000 Saturdays with our children, we really should think about how we use that time with them, and
Absolutely.
how we not only parent, but how we nurture and enrich their lives, because they do ours.
Yes. Yeah.
So you're sitting in such a wonderful role out in the community, Penny. You must feel very lucky sometimes.
I do. I feel really honored to meet so many wonderful people out there in the world, and it's good work.
Do you
It's
ever get
good.
to see children as they grow up and
Oh, yes.
blossom and
Yes,
change?
and grow and change and grow. Yeah, it's a wonderful because a lot of the work that we do is so short term that we don't really get to see the benefits till much later. But there will be people who stop me on the street and say, "I remember you. Thank you for getting me where I am." Or, "Do you remember when you used to come to my house?" And that's incredibly fulfilling.
Yeah, it's got to be rewarding. Well, I want to again thank you for joining us. I want to remind the public that there's some real opportunity here to give to the maternal and child health program, that they are in need of diapers, and I would imagine baby supply, any kind of baby supply,
yes.
baby wipes, probably cleanser. I won't name any
Yes,
particular
right.
cleansers, but people know what they are. Probably things for diaper rash, and
Yes.
just like all those different kinds of things. And how about clothes? Do you ever need clothes?
We do swap out a lot of clothes, and we'd be happy to share them out if clothes come in. There are many families in need of that.
And especially as winter approaches,
Coats
I
and
ask
hats
the
and
public,
mittens.
keep that in mind, that oftentimes, a blanket covering a child is just not enough. So really providing that outerwear, those hats, those little mittens and things. And you mentioned the plugs for the electrical outlets. Again, something that's, minimal cost to each of us, but if each of us gave one, we'd have over 90,000 coming into you
That's
in the
right.
region, and wouldn't that
That's
be
right.
amazing? So I encourage people to really think about how you can give. If you can't afford to give, dollar-wise, there's other ways to give to programs like this, and to be good advocates, and to be good parents yourselves, and to really reach out to programs like Maternal and Child Health and Penny, who's providing an amazing service out there. So I want to thank you, Penny, for joining us. Do you have
Thank
any
you for
last
having me.
words for folks out there?
I just want to say thank you for being out there and for watching the show. And please know that you can call us if you need some help. It's it's hard to reach out, but we're right here ready for you. And thank you to the Monadnock United Way for supporting this.
And thank you to all of you donors out there who make a difference in programs such as this. So I want to remind each of you that you have an opportunity to make a difference in the Monadnock region, whether you're an upcoming parent, a current parent, someone living out there, you make a difference in people's lives. Remember, give, volunteer, advocate, be part of Living United. Thanks for joining us.